Good evening to all. Today's research theme that I'll be discussing is based on a research where they provide us a flowchart for the initial diagnostic management of patients who are suspected to have coronary artery disease, right? So this is illustrated through this step-by-step flowchart. So let us have a quick look of what are the steps or what are the protocol stages that they are expecting us to use for a suspected CAD patient or suspected CAD individual. So, first, you need to assess the symptoms by performing certain clinical examinations, like it can be ECG or even biochemical investigations like the troponin levels or uh, certain parameters, or even a resting echocardiography. And in some patients, maybe a chest x ray could also be used. And then, as you assess the symptom, if the symptoms are consistent with an unstable angina, then of course you can follow the specific, that is, non-ST elevated or the acute coronary syndrome guideline. While you're assessing the symptom and while you perform the clinical examinations, and at the same time, if you consider certain comorbidities, then of course you can start on a medical therapy. At the same time, with the comorbidities, if the cause of the chest pain other than CAD is not confirmed, and if it's just a typical angina, and if the typical angina is a yes, then of course we can offer ICA, or if revascularization is possible. But if the typical angina is not the case, then you assess for the presence of the coronary stenosis using coronary angiography. And based on this, so you can have either low PIPs or inter PIP or even high PIP. So if it is a low PIP, then of course you have to investigate other causes. But if it's an inter PIP, then maybe non-invasive testing can be used. Or if it's a high PIP, forced with some, you have to proceed with some risk stratification. So this is a general diagnostics strategy that could be followed if for a suspected CAD individual. So this is how the diagnosis should be established. Thank you. All right. So I hope this research theme of today would be helpful.